Hey, it's Dr. Ko here from Reset Ketamine. And you might be wondering, why don't health insurance companies cover IV ketamine treatments for depression? You might have seen the latest studies and the latest articles showing that, yes, it can be beneficial for a significant percentage of patients who have treatment-resistant depression. Some of the main arguments against getting IV ketamine covered by insurance companies is, number one, it's not FDA approved for the use in mood disorders. Ketamine is a very old drug. It's generic. It was FDA approved in 1970, and it's been used for over 50 years for a different purpose. And that purpose is typically for use in the operating room or the emergency room for various procedures that are painful. The insurance company argues, hey, there has never been any FDA approval for use in the mood disorder, and that is true. Also, they argue that there's not enough studies. That is partially true in that the majority of the studies using IV ketamine for depression or PTSD, they're very small. So one of the reasons why they're small is because ketamine is a generic drug, which means that there's not a lot of research funding available for generic drugs. A pharmaceutical company will typically invest billions of dollars for new drugs. And the reason is they want to create patents that will last 20 years so that they can make profits for their company, which is part of, the purpose of a pharmaceutical company that is publicly traded. But going back to ketamine, it's generic. So meaning that it's readily available. No one needs a special patent to produce this. The third reason why ketamine infusions are typically not covered is because there's just a general lack of awareness. A lot of patients and people in general, even physicians, nurses, are not aware that IV ketamine can be used for patients with depression, anxiety, for PTSD, just because there's not a lot of information out there. So I just wanted to cover a few reasons why ketamine infusions are not covered by insurance companies, just so you can understand their perspective. Let me know what you think about this. Leave me any questions or comments below, and I will catch you next time.